Shafi, tell us about the new technologies used for surgery.
So surgery is going through a great change in terms of technologies. We're seeing artificial intelligence being used in the operating theatre in real time to direct surgeons to the right parts of an operation. We're using virtual reality, augmented reality to overlay information on top of the real patient, like scans and images, to help navigate through difficult parts of the operation. So we're seeing a whole plethora of technologies that are hopefully going to improve surgical outcomes.
So out of these technologies, which are today in use in practice?
Well, what we're seeing now is augmented reality platforms being used, whether it's for telemedicine or telementoring, remote training, or indeed overlaying information in real time to plan to make surgery more precise. So we have two of those solutions now with American FDA approval for use in the hospitals. So now we're seeing instruction in many parts of the world.
So you've mentioned training. What about the influence of these technologies in education for medical students?
So education needs disruption. Medical school curriculums haven't changed for many years, and these technologies are allowing us to democratize education so people can actually learn remotely. What we'll see in the next 2 to 5 years is curriculums embracing virtual and augmented reality for training. Virtual reality allows you to retain 80% or more facts just by learning that immersive medium. We'll also see the change in the curriculum, so students now will be able to be more digital in their kind of learning material. So entrepreneurship, innovation, new technologies, digital health need to be brought into curriculums to produce the future doctor of tomorrow.
So what are examples of the very new, the hot technologies which are emerging only now?
I think artificial intelligence now is becoming really interesting the way it's being deployed. We're seeing voice technology and AI interfaces allowing, for example, patients to connect with doctors remotely using just AI systems with natural voice language processing. But also in the operating theatre, we're seeing now this extraordinary ability to look at a screen, have an AI interface to allow you to name structures, to navigate through an operation, let the whole team in the operating theatre know what's going on next, to plan and be more precise. So hopefully that will allow us to be more safe in the future, but also to validate surgeons amongst themselves, to ensure that we're quality and we have the metrics and big data analytics to ensure that we're driving that change.